please. There we go. Next slide, please. My name is Kayla Emmerich, and I'm a Public Health Associate with the Technical Assistance and Research Center, also known as TARC at NCUIH. Joining me from the NCUIH team are Margot Bailowitz, Public Health Associate, Divya Nunduri, Technical Assistance Program Manager, and Rachel Dio, Communications Associate. We are honored to have you all here today. We kindly ask that you place your name, organization, tribal affiliation, and title into the chat box. In addition, we welcome any feedback you'd like to provide about your webinar experience in our survey, which is posted in our chat box. Next slide, please. I'd like to bring to your attention to a brief disclaimer that this event is made possible by the Minority HIV/AIDS Fund through the Indian Health Service. Next slide, please. As shown on the agenda, we will begin with the session overview and some housekeeping, followed by an introduction to our wonderful presenters, a brief gentle stretching activity, and the presentation. We'll end the session with a Q&A and adjourn promptly at 3 p.m. Eastern. Next slide, please. For those of you that are unfamiliar with NCUIH, here's a little background. The National Council of Urban Indian Health, also known as NCUIH, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service in the Indian Health Care Improvement Act, or IHCIA. NCUIH strives to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide. As we dive into our session, here are a few things to keep in mind. This session is being recorded. All mics have been muted unless otherwise directed. Questions can be typed into the chat box. A Q&A will follow at the end of the session. And please note the QR code at the bottom of the slide. Scan this with your phone to access our feedback survey. Next slide, please. To ask a question, first select chat at the bottom of your Zoom screen, then type your question or comment into the chat box that will appear on the right of your screen. Next slide, please. I will now introduce our presenters for this session. Kevin LaChapelle joined SDAIHC in November 2019. He holds expertise implementing culture-focused performance improvements in clinics, ambulatory surgical centers, and hospitals. Kevin has a focus on integrating systems and culture to align behaviors to achievements in safety, patient experience, and cost containment. He is also a community-minded leader with a lengthy history in serving refugee populations through the nonprofit organization he founded in 1999, focused on leadership development and project-based learning for underrepresented refugee communities. Jennifer Aquino is a public health nurse case manager for SDAIHC. She enjoys coming to work each day with the opportunity to help patients and work with every team member at the clinic. And finally, Ethan Landry provides wellness programming for SDAIHC, including nutritional counseling, exercise, HIV and HCV rapid testing, counseling, and navigation services. He is skilled at leading gentle stretching, balance, flexibility, and mobility for all ages, and certified as an exercise and aging specialist in 2023. Next slide, please. Before we begin our presentation, we're going to pop up our first knowledge check. Please select your answers for the following questions in the pop-up box. Here they are. And we'll give that about 30 seconds. All right, thank you so much for your answers. We will now turn the floor over to Ethan Landry for a brief gentle stretching activity to begin our presentation today. Let us give a warm welcome by placing a heart emoji in the chat box or using a heart reaction. Ethan, the floor is yours.
Hi everyone. Everyone can hear me, right? Everyone can hear me. My name is Ethan. I'm from San Diego American Indian Health Center and Wellness Department and in medical. So today I'm gonna take you with a little chair gentle stretching exercise. The first thing, please make sure your chair is stable and also make sure that you have enough space. You don't want to make sure you can stretch your arm, your leg, any part of your body. You don't want to hurt yourself before we start doing anything. First, we go ahead, make sure your posture is all straight. Open out your chest. Go ahead and take a big deep breath. We're gonna do that 3 times. You're gonna breathe in your nose and breathe out of your mouth. So make sure all the air you breathe in, make sure you breathe out of your mouth, all of it. All right, one more time. One last time, one more. All right, I hope everybody's doing okay. Now we're gonna go ahead and bring our check down, chin down, and then we're gonna roll it from the left side. Gentle, very gentle. We're gonna try to do that 3 times. 1, 2, 3. Now we're gonna roll the opposite side from the right side. Gentle. 1, 2, and 3. Bring it to the center and then go ahead and take a big deep breath. Now we're gonna go and stretch our neck, the side of it. We're gonna go ahead and use our right hand, touch the left side of your ear, bring gently down. Make sure your left arm straight. Go ahead and hold that for 5 seconds. 1, 2, 3, 4, 5. Now bring it back to the center and go ahead and take a big deep breath. Now we're gonna do the same thing. The left arm touching the right side ear. Go ahead and straighten on your right hand. Bring it gently down. Hold that for 5 seconds. 1, 2, 3, 4, 5. Perfect. Go ahead and bring it back to the center. Go ahead and take a deep breath. Now we're gonna start roll the shoulder backward. We're gonna try to do that 15 times, and then we're gonna do forward. Okay, ready? Make sure your shoulders are straight. Now ready? 1, 2, 3, 4, 5, 6, 7, 8. 9, 10, 5 more, 11, 12, 13, 14, 15. Perfect. Now you're gonna go ahead and open out your chest. Take a big deep breath again. Now you're gonna go ahead and roll forward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. Now go ahead, take a big deep breath again. Now we're going to start to stretching. You're going to use your right arm touching the left shoulder, the left hand touching the right elbow. You're going to gently bring your body to the left. Hold that for 5 seconds, please. 1, 2, 3, 4, 5. Now you bring it back to the center. Now you're going to move your left arm touching the right shoulder, the right hand touching the left Although you could bend your body to the right. Hold that for 5 seconds. 1, 2, 3, 4, 5. Perfect. Bring back to the center. Relax your shoulder. Go ahead and take a big deep breath with me. All right. Now we're gonna go ahead and twist our upper body to the left. You're gonna twist as far as you can, and I'm gonna hold that for 5 to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bring it back to the center. Go ahead and take a deep breath. Now you're going to go ahead and twist to the right as far as you can, okay? Gentle. Hold that for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Bring it back to the center. Go ahead and take a big deep breath with me. Now, we're going to use our right arms cross body, up front body. You go ahead and give a little spot. Hold that for 5 seconds. 1, 2, 3, 4, 5. Now we're going to use left arms. Switch it up. Gentle. Hold that for 5 seconds. 1, 2, 3, 4, 5. Perfect. Go ahead and take a big deep breath. Open on your chest. Now you're going to use your both hand touching your low back. Try to reach your low back. And then you gently bring your neck up, look at the ceiling, squeeze it on your upper shoulder. Hold that for 10 seconds, please. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. I think that's the last exercise for today. Thank you so much for your time. Appreciate you all.
Thank you so much for inviting us to participate in that gentle stretching, Ethan, and for showing us what you do best for San Diego. We really appreciate it. We will now turn the floor over to Kevin, Jennifer, and Ethan for their presentation.
Thank you all so much for just the opportunity to be able to present today. And first, I really want to give a special thanks to Jennifer and Ethan, two very highly esteemed members of our team that are just strong leaders in all that they do. In particular, every Friday, they have a healthy lunch thing that they have started and has been just very powerful in our organization, where they actually make food for everybody to enjoy, which is a healthy choice for food. So I thank them big time for just all that they do. I want to just start off just giving a little overview of kind of who we are and where we've been, especially now in a post-COVID time. And we can go to the next slide. This is just our objectives. And we can go to the next slide. The next slide. So our organization, we have kind of a tough building structure, which many FQHCs do, because we were once an apartment building, and so sometimes it lended itself for some challenges with patient wayfinding and things. When COVID happened, as an organization, we all kind of came together and hunkered down and said, you know, how do we want to handle this? Do we want to reinvent ourselves and really be there for our community stronger than ever? To which everyone agreed. So we took advantage of the time when we were doing a lot of the telehealth, and we did a whole facelift or outside of our health center. And the next slide, even on the inside, through some grants that we were able to receive, getting rid of all the carpet and having healthcare grade vinyl flooring, which was really, really amazing. And the next slide. And so we try to really say, let's have this a very presentable organization. We think that's also conducive to wellness. And so, you know, we do medical, patient-centered is our big focus, and a holistic approach. And we also have behavioral health and dental care. And we try to integrate these things. We also have a youth program and our wellness program, to which Jennifer and Ethan do an amazing job. And we really try to have that as to everything that we do, that we believe that everything is interconnected. And our HIV program, Ethan has done an amazing job. He's a very strong ambassador for our community and for our health center. And it's just been incredible, the different outreach events that they have done to where they have strong impact. And the feedback that I've received from patients is just amazing because of the way that they, I would call it destigmatizing HIV in some respects, but also Ethan's ability to connect with people and really have an understanding of what they're going through. And he's been an amazing coach, in addition to his ability to do the gentle stretching and things like that, which Jennifer and he are also very involved with our elders program. You can go to the next slide. So these are just kind of the numbers of our health center, and the 44 years, coming up on 45 years. The patient numbers that we see each year. We have almost 80 staff right now. We'll go to the next slide. So this is just a little bit about our organization. We also recently, last year, received our SDAIHC accreditation, which is really nice, and also CARF for behavioral health. And then we've had some different recognitions, which have been really nice for the hard work of all of our staff. And we go to the next slide. So this is kind of just sharing a little bit about our diversity in our workforce. So we're going to be building a new center. And so as such, we had to start putting some documents together that the city wanted. And this was one of them that we put together. And it was really interesting because we saw how reflective our team is with our patient population, and that there's a lot of alignment there, which is really, really neat. And also the cross generations that we have, not only with our patients, but again, also in our workforce, from baby boomers and then to Gen Z all the way through. And you can see that the staffing levels that we've been growing. And so that's kind of nice. We will double in size as we go into our new health center. And we can go to the next slide. Our mission, really promoting excellence in healthcare. Some of the things that I remember hearing from people sometimes is they say, well, this is just a community health center. And I don't like when I hear people say that, because all of our patients must have excellent care, just like they could get anywhere else from large health systems. We have to make sure that we are being at our very best for our patients and their families. So we also want to reduce significant health disparities among San Diego Urban American Indian, and we're actually dually funded. So we have a third of our patients as a Native American, and then we have underserved population 2/3. And our vision, as a community health center, we want to make sure that we're dedicated to embodying the values central to American Indian culture. We embed a lot of things from talking circles and a lot of our Native tradition to really infuse that in the care that we provide. Also, really having a heightened sense of making sure that we have really deep respect for our patients, acknowledging the whole person and everything that we do, working together, ensuring health for the individual and the community. And I would even add in there that we become very focused on making sure that we all take care of each other here. Sometimes in healthcare, we're good at caring for others. Well, we're not so good at caring for ourselves. And so that's been a big focus. And Ethan has always been an ambassador, and Jennifer in that respect too, which has been very nice. We open our health center for all tribes, all ethnic backgrounds, all walks of life. And we want to offer that comprehensive care and contributing really services to the whole family. And we really enjoy our elder program, being involved with our youth program as well, and all of the advantages that brings to our young people, having the Native elders be able to have impact on them. And we can go to the next slide. We have an amazing board of directors. They just have done just a great job in navigating and helping us through, especially through COVID. And they've all stood very strong and very great resources for us. I couldn't speak more highly of a very highly engaged board that is very, very concerned about the health and well-being of our community. And they also are users of our health system, which is always very nice as well. Next slide. In our leadership team, we have our CFO Tammy, Dr. Clement is our Director of Behavioral Health, Dr. Richardson for Dental, Dr. Estrand is our Medical Director, Johnny for QI, and Moon for our IT, PI Analytics. And we have a really great team. We're really blessed, and we have a great team all the way through all of this staff. It's been really an amazing thing. During COVID, we faced some challenging times. One of our nurses had both parents pass away from COVID at different times. We had another MA that had her mom had passed away, and we also had a couple of employees that had very serious COVID, and we all really kind of rallied together. And so I think that was really something that was neat. I know for me, it changed me as a leader and my approach to leadership. So it's had major impact on me as well. Next slide. This is just kind of a infographic of our community and just the demographics and economic as well, also some military. And so we kind of are a data-driven organization. So we really like data that tells a story and helps us to understand how well we're doing and where there are opportunities to improve. Next slide. So we accept the different health insurances. We also have a really good patient services team that if someone does not have insurance, that we really work hard to find a remedy for that so that we can make sure that we're treating everybody the best way we can. Next slide. Our wellness program, I think, is foundational for the organization. From Ethan's HIV and PrEP program, we have Wellbriety, the Healing Circles, again, Wisdom Keepers for our elders, and the youth program. I believe that I've been in many organizations. I would say that we have such a strong bond with all of our staff and a partnership with the community that is really nice. We don't really see it as our patients are over there and then we're the staff. We're all together in this, and I think that's really nice, the relationships that are built. We learn a lot from our patients. We learn a lot from our elders as well. Next slide. So we try to have standards like experience standards of really understanding our patients, and again, offering that respect and getting to know our patients, being able to listen to them of what's going on. How can we be at our best for them, anticipating their needs and being able to position ourselves to really help empower them in their care. We're very into engaging our patients so they're a part of the treatment team, which is really helpful, and I think the only way to go. Next slide, please. So our future, right now if it wasn't for telehealth, we wouldn't be able to have the capacity. Behavioral health almost tripled during COVID for all the anxiety and depression and all the things that COVID brought with it. And so we are growing and we are running out of space. And so if we go to the next slide, our focus is really going to be to almost triple in size. So we're working right now, hopefully going to break ground within the next 6 months. Phase one is we're going from now about 17,000 square feet to about 58,000 square feet. And that'll be phase one. And that's a building next to where we're at now. So we'll stay, our building right now is where it says phase two, but it doesn't look like that yet. And so the building we're at now, we'll stay in here while they're building our phase one. Then we will leave here and we will all move into that. And then we will demo our current buildings, and then that will become affordable housing for our Native elders. And we're really excited about that. Hoping to have between 60 and 70 units. One of the things that we're trying to do is we're not going to go down the road using HUD, because we've gone to other programs that did that, and it was very hard through the lottery system to actually get Native patients to be able to have those units. So we're going to be doing it in different alternative methodologies so that we can make sure that we're offering these things for our Native elders, especially those at risk of being homeless, which we did a survey and found that was pretty significant. The other thing is we're offering additional programs. So we're going to focus on women's health and men's health, and then also expand our pediatrics, but also a lot of our wellness. We'll have up on the rooftop. Ethan will probably be out there often doing his leading his exercises and things like that, because it'll be an open air on the backside. So half of it will be an open air patio. The other thing is going to be conducive to a future pandemic, as we all know that is likely. So we'll have negative airflow and things like that, and it'll be environmentally friendly, everything. So we're really excited. We're using human-centered design so that our staff are engaged in, and our community, our patients, and even our neighbors, our youth program, our elders, in helping navigate to what will our clinic be like? How is it going to be designed? What are the things that everyone wants it to be? And what about even the native culture piece of it? And so it's really an exciting journey for all of us. And our community is actually very supportive. They're excited for it as well. Many of them now receive their care here as well. Next slide. So I'm going to pass this over to Jennifer and Ethan, but just to kind of close out for me, I think this has been the greatest privilege to serve as the CEO here in this organization. It's been probably the most positive experience I've had, and I've had experience in larger health systems. But it's just been an amazing journey here, amazing learning. I think one of the things that we're really focused on here is we don't really go by hierarchy and titles. We're all in this together, and we all learn from each other. And we try to be supportive. One of the things I'm very proud again with Ethan is his ability to connect with patients, with his patient population in such a special way. And the many times that they have commented to me and told me what an amazing support and how much impact he's had on their life, going from feeling defeated to feeling like, you know what, I can get through this. I've got support. We can do this together. And then Jennifer's ability as well, her and Ethan's connection. When they work together, it's an amazing team as they go out into the community, from taking food to our elders, produce and things like that. It's just amazing in their natural ability to connect with people, and they're well known within our staff and the community for the great work they do. So thank you again for having me, and I will pass off to Jennifer and Ethan.
Thank you so much, Kevin, for providing a great overview of our clinic and being able to convey what the future has in store for all of us. We're excited as well. But thank you for being an amazing CEO and a great source of support, and being a super example of a great leader for us. And so I'm Jennifer. I'm one of 5 Jennifers here at the clinic, and 3 of us nurses are named Jennifer. So you can imagine the confusion, but I'll just go by Jennifer A. So we'll start with our wellness programs. The programs that we have here, they are very near and dear to us. Each one just has a way of bringing together individuals that are dealing with struggles, and it allows us to help uplift and empower them. But there's a variety, and there's more than this, but Wellbriety, healing circles, elders, youth, prep with Ethan, the general stretching exercise class with Ethan, and then of course our diabetes education with our nurse Ronnie. And next slide, please. The Wellbriety and healing circles, it's important that we support a healthy community development, physical, emotional, mental, social well-being. It's all encouraged through these programs. And our spiritual advisors, Rob and Margie Anderson, are wonderful, and Margie also is available with her double role as a substance abuse counselor. And next slide, please. And these are programs that are offered by our youth center. Our youth are absolutely our future. We want to support them by connecting them with culturally based activities that build their self-esteem. There's a garden that we have in the back of the clinic. The youth and our staff help build this up, put it together. And Coastal Roots Farm, who you'll see in a moment, is going to help lift the beds, and there's not too much sunshine back there, so they're going to also assist with that. But having the assistance of an organization that already helps us so much, we definitely value them so much for helping us out with that. And it serves as a space for patients, even members of the community. They're all welcome to sit back in the healing garden and just enjoy the serenity back there. And next slide, please. Here we have our partnership with Coastal Roots Farm. This is a huge, just a wonderful organization that's a big part of what we do here too. The way they help, they're a nonprofit community farm and education center. They welcome everybody and anybody to their farm. On Sundays, they even have whatever you can afford. So let's say if you only have a quarter on you and you want to fill up your grocery bag with their fresh organic produce, that's okay with them. It's just whatever you need, they're okay with that. And it's a really good way for us to connect with our patients and the elders. And so what happens is Garth, with his van and his refrigerated produce in the back, they bring 25 bags to us every month. And we get to distribute 20 of them out into the community. And there's some of the fresh produce. 5 of the bags actually go to the youth center, and our substance abuse counselor, Margie assists the youth and the elders. They all cook together, and so that they can learn to be a little more self-sufficient when it comes to their diet, see what good you can do with fresh, healthy vegetables. It also allows Ethan and I to foster relationships with our elders, community members, and patients, and to maintain that connection to our different departments, for whether it's medical, dental, behavioral health, and wellness. And then we mentioned that the healing garden, that we have plans with the youth center and the elders to work with Coastal Roots to make the healing garden even better. Next slide, please. And with the produce, we have the opportunity twice a month. We get to visit 15 to 20 patients. And so we'll take them a bag of this produce, and we get to travel out to their homes. And this really helps us to maintain these connections and build their trust. One thing that is very, very special is that a lot of times the elders will invite us into their homes, and they have some sentimental items that they share with us. They show it to us, and they have storytelling. And so, you know, if we're there for half an hour to an hour, it's important that they are heard, that they get to share their stories and good memories. And, you know, this teaches us so much. We respect them a lot. And it definitely gives me a chance, if they have any health conditions, it gives me a good chance to do a nursing assessment, maybe check and make sure that they know how to use their blood pressure cuff, things like that. Sometimes when patients come to the clinic, they've got white coat syndrome, and so they tend to forget some of their questions, or maybe they're there for a myriad of problems, and so there's not enough time for them to ask all the questions and concerns that they have. So building this rapport with the patients and us seeing them in their own element, that gives them the opportunity to bring up the concerns that they may not get to ask when they come into the clinic and have an appointment. But we can do screenings for depression, for food insecurity, things like that. And it's the perfect time to do case management also, and give them resources. Ethan can tailor some exercises to that individual. And next slide, please. And just a little bit more about Ethan. So he doubles as our wellness coordinator and our prep navigator. So each patient that comes in to see him, he really does give them individualized attention. He leaves his schedule open so that he's able to see walk-ins and patients that we normally don't see on a regular basis. He's very open to that. If somebody tests and their result is negative, he makes sure to educate them thoroughly on PrEP medication. If somebody's positive, he ensures that they're linked to care right away. And he's great about maintaining good partnerships with UCSD, AHF, and other organizations. And I'd just like to say that Ethan exudes such a positive outlook. He really is the face of our clinic when it comes to a healthy mind and body. Next slide. So our HIV screening procedures, this is done for every patient that comes to our medical department ages 13 to 64. And unless if that is declined, and the entire medical team, they all work to make sure that we screen for at-risk behavior. And also we remind each other to offer rapid in-house testing or home testing kits. Providers will counsel patients and then send them directly to Ethan. And next slide, please. The HIV interconnection with other health and wellness concerns. This is something that's critical to us. Screening and confirmatory testing. We want the patient to be able to receive care from a specialist right away, same day or just ASAP, because we want them to be their healthiest possible when they're on medications and when their body is fighting HIV or other opportunistic infections. And we'll make sure to test for other STIs. And we also want to take the holistic approach and make sure that we include their mental wellness, their dental care, reinforce regular physicals, make sure their vaccines are up to date, and that they're receiving good information on nutrition and exercise. And next slide. Awareness and prevention outreach. We do like to participate in outreach events. This gives us such a great opportunity to reach our patients that have come there for the event, and we've got their attention, and so we take advantage and make sure to engage them in the topic. And next slide. And so here's a dashboard that we have. You can see the testing trends and different tests. And next slide. And then here are test details, so by test type. And then we have broken it down through by age groups, whether they are native and non-native, and also by gender. And next slide. Care packages. Ethan, I'm not sure how many care packages you've given out to date, but it's many. He has put these together all by himself. And it's basically a gym bag or a travel bag, and we fill it, he fills it with water bottles, blood pressure monitor, digital thermometer, masks, journal, pen, so many things are in there. And they're all great items that patients can use. The blood pressure cuff has been a really, really helpful tool. This allows the patient to see that, okay, this week I was maybe eating just Dave's hot chicken and not getting any exercise and not following through with my medication. It allows them to see on their own time and then record it, how that can affect their blood pressure and things. And then we ask them to bring in their log when they come in for their appointment, and providers just help them evaluate their logs and see what they can do, what they can talk about to improve their health. And we'll include HIV home tests in there if they prefer, and Ethan makes sure to follow up with the patients that take one of those home. And next slide. Cultural sensitivity. This is such a sensitive subject for many people, whether it's testing, prevention, just talking about it. And providers, we're the providers and trusted healthcare teams, so we want to approach this topic very gently, keeping in mind that for many cultures, it's difficult for our patients to talk about, particularly our Native population. And we do try to stress it's better to know so that we can get them the proper treatment if necessary, and that the sooner the better. And it's the utmost importance that our Native population, we remind them that they have the support of their Urban Indian Healthcare Center. And this is part of the vision of our founders. So we want to ensure that we follow through, carry that on. Over to the right, you'll see there are some items. They're pretty precious to us. They're collected through the years from elders, from patients and community members. And so we like to put those somewhere in a glass case, like to keep those nice and dusted. And next slide. So Kevin mentioned Healthy Kitchen on Fridays. This is a team building activity for our clinic every Friday. We gather the nutritious recipes that we make sure it includes a protein, fruit, and vegetables. We put money together and we buy the groceries and we cook from scratch. We encourage each other to incorporate any flavoring, maybe a certain style of cooking that we learned growing up. And then we invite all the staff to come over and have lunch after. It all starts here, nurturing of three sisters. We come together, we gather as a community. One department gets to know another that they may not normally interact with every day. And we share this culture of supporting each other. It's important we build those connections. It's vital to our clinic because it starts a chain of events. When we begin within our clinic, we spread the positivity to our patients throughout the rest of the day, the week. It's about togetherness for us and what we can do to take action for a healthier lifestyle. We found that staff are excited to help plan meals, contribute the ingredients, and participate. Then the following week, we get to do it all over again. And still making sure to spread word to patients, giving them encouragement and education for a healthier lifestyle. And next slide. And that concludes our presentation. I just want to thank each and every one of you for being a special part of our audience today.
Thank you so much to all of our presenters for that amazing and informative presentation. Please place an applause emoji in the chat box if you'd like to. Before we begin our Q&A, we're going to pop up our final knowledge check for the day. Please select your answers to the following questions in the pop-up box, and we'll just leave that up for about 30 seconds again. Good. All right, as you finish up answering those questions, the floor is now open for any questions or comments you may have about today's presentation. Please feel free to turn on your cameras and come off of mute, or feel free to place your questions in the chat box. We'll keep an eye on that as well. The floor is open for questions. And I have a question. I know something that comes up quite a lot when talking about the successes that organizations like yours have seen is just what it takes to form those partnerships within your community. You talked about the clinics that you partner with, the local farms. So how did you succeed in forming such great partnerships with those other local organizations?
As busy as everybody gets, I think keeping the lines of communication open, so important. We tend to get lost in our daily grind, but just keeping those connections and saying when, okay, let's do a phone call next week and following through with those kinds of things. Ethan, I think you got the opportunity to travel up to Coastal Roots Farm. You drove up there?
Yes.
Yeah, so And then another organization that we're partnered with, we went to go have tea with them. They were actually just a couple of blocks up from us. And so just really making the effort and making sure to follow through. I feel like that's key.
Yeah, absolutely. Thank you for sharing that. Yeah, that's such an important part of the process for sure. I'm wondering as well, I know you talked a lot about the places where you've found a lot of the success. You've had such amazing connections within your community. What barriers did you face in implementing this programming, like getting out those wellness packages or starting up your wellness programs? What did you encounter that you had to kind of work through those challenges?
When I started doing this was, I've been here over 2 years, but you know, the community members, the patients, they didn't know me. And so they were hesitant to answer their doors even because they don't know who I am. It's just some new lady. And then each month I made sure to visit the same patients and then try to follow up with phone calls and stuff. And then look out for them on the schedules if they were coming in, you know, just engage them in casual conversation. And that way, you know, every time they come in again and again, they go, oh, it's Jennifer. Okay, I think I can ask her a question. But, you know, just kind of reintroducing yourself and then making yourself a little more familiar. I think that helped a lot. Another barrier, we take the van out a lot in the community. The places we tend to go, it's in the city, and so the parking's really bad. And so it really helps us to have 2 people there. One will wait outside and then I'll go up to the door or vice versa. And you know, Ethan's so nice, you know, sometimes patients can take about 30-40 minutes and, you know, we want to say what we want to say to them, but he'll still wait outside and he's really understanding. So I think also having a partner to work with that's understanding of patients' needs, that's been a great thing too. And then for other local organizations, I think just again, making sure we make the time to meet with them and converse with them. And it's also a great opportunity to keep the network going, because then, you know, we make new contacts from this organization and so on.
That's great. Yeah, thank you for sharing that. That's really great to hear. It can certainly be tricky it takes just a lot of manpower, a lot of hours, a lot of repetition, and just that commitment. So thank you for sharing that. I want to make sure everybody has chances to ask their questions. Again, feel free to put any questions you may have in the chat. Feel free to come off of mute and ask. Yeah, the floor is open to everyone.
Can I ask a question of the audience?
Absolutely.
Okay. I'm curious, does anybody have, from different organizations, do you have a similar program where you get to reach out to patients and community members by traveling to them? And if so, how has it been going with you and that program?
Yeah, we would love to hear from all of you. Again, feel free to just chime in the chat. I'm happy to read out your answers there, or do feel free to come off of mute and talk about the programs that you have. We do have a thank you in the chat. Thank you for the lovely presentation. We've got an answer here. I do outreach with education across Northeastern Nevada, and I do have some pushback sometimes of people being unwilling to discuss HIV in general.
Yeah, I can, it's easy to feel that vibe when others are uncomfortable about the subject. And I think persistence is important, gently, delivering that gently and just being sensitive to their culture, to what their beliefs are. Sometimes they just don't want to talk about it. And, I can kind of compare to, let's say if we're offering a COVID booster, not everybody wants that. Not everybody believes that. And so, just a gentle approach works well, and then backing off if they say no. But I do like to throw in, if you change your mind, my name's Jennifer, please come see me. And then they'll go, oh, okay. And I feel like that approach has been good. And I have had some people come back and go, hey, you mentioned you guys can give me one to do at home. And so we've gotten that before, where they actually asked at a different time, maybe after they thought about it or something. And I think, Ethan, you've been able to speak with patients that ended up testing at home, and they did call and follow through and give you their results, and then you were able to discuss that with them and offer them some guidance.
Yes.
Yeah, Ethan, would you like to expand just a little bit more about what those conversations can look like what concerns might come up from the patient end, and what you do to help them feel comfortable talking through something that can be really difficult to talk about?
Sure. I don't know where I can find my computer as. Can anybody hear me?
Yes, yeah, you sound great.
Yeah, it's just listening to them, like everybody, whoever dealing with anything, sickness, not just HIV, you're talking about diabetes, you're talking about cancer, it's especially when it's come to personal, essential health, like disease, you show a new face and you just talk about something so personal, how you're gonna do that? Why, anybody will come across like I don't know, you don't even brought me that kind of conversation, they will really push back. So really, but then what I do with them is that, okay, is that I'm here I hear you, and it's wherever you are right now, that I'm here with you. So let's have a conversation. You choose the topic. Let's just say I'm going to give that person 10 minutes or 15 minutes. We don't know. That's just, okay, I'm here, whatever you're comfortable, wherever you are, I'm here to listen. I'm here to support you. And you don't really say it that way. And it's also the language too. Like, because if we come from the medical perspective, they think that you see me, something wrong with me, So we don't want that to see us that way. So, hey, I'm like, you approach it like, oh, hey, stranger. Usually you use basic language. Hey, stranger, I'm here carry these resources. It's something you want to learn about or something that interests you. If you do, then I'm going to hand out to you. If you have a question, I'm here going to be 5 minutes, 10 minutes next to you. You can ask me. I have more, I can, if I can't answer the question, I have connection, which is Jennifer, which is provider, everybody. I know I work with the doctor very closely. If they don't feel comfortable with me, they may feel comfortable with Jennifer. That's how. If they don't feel comfortable with Jennifer, then you know what? We have a clinic and we have a provider. We have maybe some patients are so educated, they don't really, they are like nurse or doctor, athletic, they're really good at exercising, really good at taking care of themselves. They're pet nutrition and they're so professional. So like me, come in and talking about something that I barely know, like they would think, who are you? You can't even speak English properly, So you can't talk to me. There's a lot of different type of barrier, but for me, that's not a barrier. That's an educational and also that's opportunity for me to grow as a person and exciting for me to make fun of myself. You know what? You have something offer. You have something you can offer to me. So I'm interested. Can you teach me or thing like that? I approach that way. I don't know. It's just something that definitely helped me a lot to do what I do here. And that's my way of approaching patient. I didn't call them patient. I call them people, like in general. We all patient. First, I started to introduce myself. I'm not a doctor. I'm not your doctor or anything. I'm just a patient like you. So if you need anything with your personal health, anything medical health, like I have a good resources for you. That's all. Let them know, making sure that we are here for them.
Oh, that's fantastic. Thank you so much for sharing that, Ethan. Just that empathetic approach, that conversation like with a peer, like this is led by you. I'm just here as a resource, and really having multiple people that they can contact. That's a really fantastic approach. And I really appreciate you sharing just all of your insights from that experience. So thank you so much. We did just hit the end of our Q&A time, so thank you so much for those comments in the chat and for the engagement throughout. We can go ahead and move on to the next slide. Yeah, thank you for joining for this final session in our Nurturing the Three Sisters series. We also thank all of our presenters again for the wonderful presentation. Show your appreciation with a celebration reaction or an emoji in the chat box. We appreciate any feedback you'd like to provide about your session experience. Please complete our session survey by using your phone to scan the QR code on the slide or by clicking the link that will be placed in the chat box. Those who complete the evaluation will have a chance to receive a NCUIH swag item package. So thank you very much for filling that out. Next slide, please. NCUIH is hosting many upcoming events that we would love for you all to join. These are our events in the rest of the month of June. We'd like to specifically highlight an upcoming event courtesy of our STI team on the 21st, titled Standing Together to Address Urban Indian STI Disparities, Partnership Opportunities for UIOs. So we look forward to seeing you there as well. Next slide, please. Thank you all again so much for attending. We hope you have a wonderful rest of your day.